right, guys. Hello, hello. Hey, look. We are in the break room right now, and hey, happy I.C.U week. Oh, look, guys. So while I was on vacation in Hawaii, look what happened here. We got that chair. Well, I don't know. I don't know. I'll try it later, and I'll let you know. Okay, so tonight, I told you guys that I'm precepting right now, and I have a wonderful nurse, Terrell. So she's working right now on her charting. She's done already her assessment. So we have a moment. We don't use that word, right? So anyway, I have my dear friend Norma here, and let me turn my yeah. So this is Miss Norma, and she's a CNA. And I just want Norma. I want you to talk. I want you just to talk to me um, about everything what you're going through right now in your life, and it's okay.
It's too much to talk about, but I'll try.
Okay.
Um, Number one, my health issue, my cancer. I just came back from Portland. I had treatment, a new treatment called CAR T for bone marrow cancer. I'm actually feeling really good.
Okay. Good.
And I just had some blood work done, and it said it came back good.
Mm-hmm.
But I have to keep on going every month or every 2 weeks to see how my blood is doing. Hopefully, the cancer doesn't come back. And this treatment was basically just to give me an additional time, anywhere from 3 months to 3 years of life. And then after that, I would have to, when the cancer comes back, because there is no treatment for bone marrow cancer, they will just give me a different treatment and keep on going until my body says it's done. So I pray to God and with everybody's help, especially Elena and everybody, I've been doing really good. I love my people here. They're like my second family. This is like my sister.
Well,
So,
okay, so I just want to point out that this lady, she has a cancer. The cancer doesn't have a cure. We live in the 21st century, and hopefully, we're working and we're trying, not we, but I mean, the medicine, we're trying to find the way for cure. So, this is my Norma, my friend, who has to go through her treatments, and then she comes back to work, and she work at night, and she worked in ICU. And I adore you, Norma, and I love you so much.
thank
And
you.
I want people to know that that's the real life. You know, like nurses and CNAs, sometimes we put our scrubs on and we feel like, all those stupid flyers, superheroes work there, and blah, blah, blah. No, we are people. We are alive. We are women. So please treat us with respect. Then you come to the hospital.
Yes. You know,
Um,
it's hard because we have normal lives. We have issues like family issues, marriage issues, health issues, and we have to all set that aside when we walk in those doors and we have to come here and work.
yeah.
And sometimes it's pretty hard because some of these patients disrespect us.
Well,
And it's part of the job, I understand. But it's like you come to work and you have a bad day and then you come to work and then it's still keep on going, bad day. Because a client hits you or a client it doesn't like you or a client feels like we're not treating him correctly or not giving him the treatment that he thinks he deserves or she thinks she deserves. It's just we all have normal lives, not just besides my treatment. I'm a single parent that has to take care of her 16-year-old teenager that thinks he's a man already. That you know how teenagers are. And
yeah.
then he back talks me. He thinks he can do whatever he wants. And then I have my other job, which work two jobs. Sometimes I work 20 plus hours a day, go home, sleep for.
Okay, here we go.
But
Keep
without, without your encouragement, without your words, Elena, I don't think I could have done it.
No, I just keep saying, that people who come into the hospital, they are sick, they come to the hospital, it's not best moment of their life. So it's understandable, the mood swings and sometimes angriness and concerns. But so what I want to ask you, how it feels to be a patient. So no, so now you kind of have a experience of both sides, to be
Yes.
a healthcare professional and to be a patient. So tell me about your experience being a patient. What were your expectations from the staff? Were you a bitch or were you a good patient?
I tried to be the best patient I could, but there was times I felt like I was going crazy. I felt like I got depressed for being in
Yeah.
the hospital, and because I'm used to being the CNA, not the patient. There was
Mhm.
times I would just lay there and I hear a call light and I wanted to get up, but then I was like, wait, I'm the patient, not the CNA working on the floor.
Yeah.
But I understand the patients more now because I did have that time in the hospital. I got anxiety, I got depression, I was always crying,
Mhm.
and I didn't have family that came to visit me because I was like in the I.C.U. of the cancer unit, and I would have my friend that went with me to be my caregiver, but it's still very lonely. I understand how people feel now.
Yeah.
But the staff was great in OSHU. They were so nice to me, and
Mhm.
they're like example, the nurse brought the linen in because she was gonna change my bedding, and I got up and I took a shower, came back, changed my linen, and she's like, "You took a shower? You changed your linen?" I go, "Yes," and I wiped my own butt. So she's like, "I love you for that." I go, "I am a CNA, so I understand what you guys go through," but I had a different I saw the side of being a patient, and I understand it more. I have to like step back and think of the days that I spent in the hospital.
Yeah.
Yeah.
Yeah, well, like nursing, not for everyone, that's for sure. So, well, I think I wish you wouldn't have this experience, because nobody wants to be a patient, but everyone wants to be a nurse. So I know that due to your health issues, there is no more nursing school, and it's okay. And it's okay because you are very important in our team. You are CNA, what it's like CNA2,
Mm-hmm.
CNA2. So yeah, that you can do a lot of stuff. But there is always tomorrow. Okay, so tell me what you're working on right now. What's a dream? What you're trying to accomplish now?
Right now, I'm trying to get my medical translator license, my Spanish translator license, and that's what I'm working on right now. And I am actually really happy where I'm at right now.
Hmm.
I always wanted to be a nurse. You never know, in the future I probably can go back to school, but as for right now, I have that set aside because of my health.
Yeah, I think the most important right now for you to get concentrated on your health,
Yes.
and then we will see how it goes. Okay, come on, people. We live in the 21st century, and let's get that cancer kick in the ass.
Yes.
Okay, that's a whole point. Okay, Norma, anything you want to share? Any fun story? Any sad story? Anything you want to talk about in this interview?
There's stories I want to say, but there's not appropriate. And then I remember we have gone through some pretty good, funny stuff together. But
Yeah,
no, I just want to say thank you, Elena, for everything you've done and all the encouragement you've given me
yeah,
and
you're
all those great
welcome.
words and all the love and care that
Yeah,
you've
usually
shown.
what I say to her is just like, hey, Norma, hey, let's move your butt. I'll kick your ass. Let's go. Let's
Yes.
do it. Let's go. Let's get it.
Yes. we get
Wow.
a kicking back.
Yeah, don't say that. We are like going live. People can get us
Oh,
wrong. Okay, well, that was my interview with Miss Norma, and I decided to go live on this interview because the comment I got at the beginning, it was Grey's Anatomy style. Oh hell no, this is not Grey's Anatomy. Okay, this is real life. That's a live stream, and this is my friend Norma, who is kicking cancer butt, comes to work, do does her license for entrepreneurship. That is like hard to say, right? So this is the real life, people. We are all real now. Here, you see, there is no filters. There is some fake lashes. I can
yes.
say.
Fake lashes.
Yeah, but that's beautiful because we still have time to take care of us ourselves. Okay, so when I was in Hawaii, my sister-in-law, she was teaching me how to put those lashes extensions. Okay, so here I have Norma, so she will continue teaching, and like next time, my live stream, I'll be just all pretty with all those lashes up to my eyebrows. All right, well, Norma, thank you so
No
much
problem.
for, you know, giving me this interview, for your being brave.
Thank you.
Uh, I love you, sister.
Love you too, Nana. Thank
Okay,
you.
all right. Okay, guys, that's it. That was very short live stream. It has a purpose. Um, I'll finish this live stream and I'll make it as a video so you can share this. And I'm encouraging you to be nice to nurses. Okay, please. All right. Have a good night. And we're working here at the hospital ICU. Let's go kick butts.
Yes.